Vanessa and Engage Live for this opportunity for me to share my story. So, hi everyone, my name is Ben, or you can call me Tai Tai in Mandarin, and I'm from Penang, 25 this year, a cancer survivor since 2022, and I'm currently a full-time cancer patient and a part-time digital creator. So, to talk about my story, let's trace back to year 2021 when I was still 22 years old. So, just another random day in June 2021, I found my left neck become swollen. So, I was so panicked and worried. So, I just went to the doctor because that time was around like 1 or 2 weeks after my first COVID vaccine. So my doctor said it might be just a rare side effect for the vaccine lah. So the doctor advised us to just monitor first. So if the swollen lymph node become more swollen, then I have to go back to the hospital immediately. So we just monitor. So monitor until December 2021. I started to find something wrong somewhere, which the swollen lymph node become more swollen. And at the same time, I have a long cough that's more than 1 month even I'm taking medicine. And also I started to have breathing difficulty, and also I lose weight. So immediately I go back to the hospital, go back to the doctor. And on that appointment itself, the doctor ordered a CT scan for me. So to check what's actually going on in my body lah. So in the CT scan, besides the swollen lymph node that we can see from the swollen neck, we actually see there is a mediastinal mass between my lung and also pleural effusion in my left lung. So in this case, from the CT scan, the doctor actually suspect and tell us that it might be lymphoma, which is a kind of cancer. So immediately I was admitted to the hospital for 2 biopsy. One is the lymph node biopsy, and another one is the needle biopsy. So the needle biopsy result came out first. So it shows that the swollen lymph node is actually not due to cancer, it's due to lymph node TB. So at the time, our whole family was like totally happy and celebrate and totally thank God for the result that it's not cancer. But the next biopsy result came out, we immediately pulled back our thanks to God because it's cancer. So very soon I was diagnosed with this T-cell lymphoblastic lymphoma. In short, we call it T-LBL. So this is a kind of cancer that starts in our lymphatic system, which the immature T-cell is supposed to become mature T-cell, and then they can fight infection in our body. But in the case for T-LBL, the immature T-cell just produce more immature T-cell, and then they form tumor in our body. So as this kind of cancer is quite an acute and aggressive kind of cancer, so immediately I start my treatment, which is the chemo. And this chemo plan is a 3-year chemo plan, which is like totally like I'm taking another degree lah. So this 3-year chemo plan, for the first year, it is an intensive chemo. And the second year and third year will be a maintenance chemo. And currently I'm in 3rd year already. And also the treatment plan that I'm using is actually a multi-agent chemotherapy protocol, which we use a combination of different drugs. And these different drugs get into my body through different ways. Some of the drugs get into my body through IV, and some through oral, and some through IM injection, which is the injection to our butt, and also some through IT, which is the injection to our spinal canal. And some are subcut injection, which they will inject to your arm or your tummy. So from this picture, we can clearly see there are many kinds of drugs I'm using. So you can also expect the side effect also different kind lah. So some very common side effects that I experienced during my chemotherapy. First thing first, anemia, which is the low red blood cell count, and weird days. And all the time, I feel tired, fatigued, and also I turn botak, but now the hair come out already. The side effect of the chemo was hair loss. And also we have problem with our concentration. And also sometimes we can't poo is due to the side effect of chemo, constipation. And also due to a low platelet count, we easily get bruised here and there and feel like vomiting, nausea, and I have really poor memory and also sore mouth. I experienced a wide range of side effects from the common one to the uncommon one. And for the uncommon one, it even included delusion and hallucination. So at the time, I was suffering so much from my chemo and bearing so much pain to a point I feel so depressed. I know there are many people out there, my family and friends, they are caring so much about me, supporting me throughout my cancer journey. But still, I found myself somewhat disconnected from everyone else. Because I think no one can really feel exactly how I feel during the journey. And I'm so depressed to a point I even once told my family members, if anything happens, don't rescue me. But do I really want to die? I got the answer from the next major incident in my cancer journey. So this incident actually happened in June 2022 when I'm halfway through my first year intensive chemotherapy. So just another random day, I feel so sleepy that I need to go back to the hospital for another round of chemo. But on that day, when the nurse have a regular temperature check on me, they realized, I'm actually having fever. So immediately they called my doctor and report about my condition. My doctor ordered a blood culture for me. And very fast, the result came out showing that the reason for me to have fever is actually due to kind of sepsis. And this sepsis, to be exact, it is Salmonella septicemia. So this is a kind of life-threatening situation which the Salmonella infection has already spread to the bloodstream. So to fight with this sepsis, we actually use 5 types of antibiotics. But luckily, after 1 week of antibiotic treatment, the fever finally goes off on the 6th and 7th day. So happily, I asked my doctor, I can discharge already, right? Since I got no fever for 2 days already. So my doctor also agreed that I can discharge on that day. But the next second, when the nurse came in for a regular temperature check again, yes, I'm on fever again. And the discharge plan, of course, cancelled. But this is not the worst case yet. The worst case is, after a fever came back, I continued to have fever for the following 5 days, regardless of the ongoing antibiotic treatment. So my doctor was so headache because by the time it's already a 2nd week of antibiotic treatment, so supposedly I should not have fever anymore. But I'm still having fever every day, so he cracked his head, also don't know why. So he started to do a lot of checking on me. We did echo, ultrasound, X-ray, CT scan, and end time of blood culture. And weird enough, all this scanning, checking, the result shows it's normal. So at that time, I was totally stuck in this cycle. Every day I got fever, then we eat Panadol, and after that we got no fever for 6 hours, then I'm back on fever again. Then I eat Panadol, then got no fever, then eventually the fever also came back. So I was stuck in this cycle for around 2 weeks time. So in that 2 weeks time, I see no way out. And I'm so stuck in this cycle, I started to scare because at first although I searched online and seeing people say sepsis is very, very dangerous kind of situation, but I think sepsis is just like any other illness. As long as I comply with the treatment, as long as I take medicine, then eventually I'll recover from it. But at that time when I'm really stuck in this cycle and the doctor have no idea why I'm keep having fever, that time I started to scare. I scared, am I really going to get fever, then eventually am I going to die? But I don't want to die yet. Yeah, actually I do want to die. But now you can see me sitting here talking with you, sharing my story, then you know I'm all good now. So how we actually end the sepsis situation is that in one CT scan, we eventually found there's a pus in my right hip, and then we did one operation to clear the pus. Then after that operation, my fever goes off, and slowly I recover from sepsis. And yes, I'm all good now. I'm so good that I even spent my entire year 2 of my treatment writing my cancer memoir of year 1 journey. So if you understand Mandarin and you're interested to know about my year 1 cancer journey, or you're interested to see how's cancer to a youngster, then you may scan this QR code on the screen to get yourself a copy of my book. Alright, although I'm now a year 3 cancer patient, but I still have to stay lah. The suffering and torturing of cancer are real. But we don't have to bear it alone. Get help, get support from all those family, friends, and reach out to all the resources out there. There must be someone who can help us. And also, to all cancer patients, one step at a time. We will eventually conquer things that seems unconquerable at first, that seems huge at first. Before I end my sharing today, let's discuss one last question. So this question is actually not from me. It is from my very first cancer friend who had already passed away. So this friend actually suffered a lot from his cancer and he bear with so much pain. He is so frustrated that he once posted on his Insta story this question: why on earth does cancer exist? You know, when we got cancer and we tell our family, friends about this thing, we tend to receive a lot of questions in return. People tend to ask, hey, how come you kena one? Is it because of your personality? Is it because you suppress too much? Is it because of lifestyle? Amoy, you too much stress ke? So I also encountered this kind of situation. I received so much questions like this that I even started to doubt myself. I kena cancer memang my fault kan? Is it really my fault that I get cancer? Is it really my problem? So to all cancer patients out there, if you're also facing the same situation, all the diet thing, lifestyle thing aside, I want to tell you, it's not our fault. At least, it is not entirely our fault. We have suffered enough. Jangan lagi take the blame. It just so happened that sometimes bad things happen to good people too. So, back to the question, why on earth does cancer exist? I myself don't have answer for this question, but I've heard of one very ideal question that really touched my heart, and this answer is from my elder sister. To this question, why on earth does cancer exist? My sister replied, is to find a brave one. So that's all from me today. So if you're interested to listen to more stories from me, you may search me online. You can search 生活胶囊馆. Then I'll be there telling stories. Yeah, that's all from me today. Thank you.